During ESMO 2022, I had the pleasure of presenting our work showing the links between air pollution and lung cancer in never smokers. It's been a bit of a conundrum what causes lung cancer in never smokers, principally because we don't know what the underlying environmental carcinogens are that contribute to it. It's been known for some time that air pollution is associated with lung cancer risk, but it hasn't been known how air pollution causes lung cancer. So in this study, we do three things. The first thing is we look at the epidemiological data around air pollution levels and lung cancer risk in never smokers, finding a good correlation in England, South Korea, and Taiwan. Secondly, we use animal models to show that exposing mice to pollution, these mice are prone to mutations in EGFR or KRAS. We see a dramatic increase in the number and size and grade of cancers in these mice after exposure to pollution. So pollution is clearly causative. The question then is how? We know that there's no evidence of what we call a DNA mutational signature in these lung cancer genomes from never smokers from an environmental cause. So if pollution is causing lung cancer, it has to be doing it in a way that's independent of DNA mutations. In other words, this environmental carcinogen is not causing DNA mutations, but is causing cancer. So how? And what we found is that air pollution exposure in both mice and humans results in an inflammatory axis involving interleukin-1 beta that transforms epithelial cells into a pseudo stem cell-like progenitor. And it's only if that stem cell has an EGFR mutation that the tumor is initiated. So the question is, where do the EGFR mutations come from in the first place? And what we found through biopsying normal lung tissue is that EGFR and KRAS mutations occur in normal lung tissue in over 50% of normal lung biopsies. And these occur with aging as part of the normal aging process. As we age, we accumulate more of these mutations. In fact, in one patient's biopsy, we found 37 different cancer driver mutations in normal tissue. So these are ubiquitous as we get older. And so we estimate that about 1 in 600,000 cells in the lung harbors an oncogenic mutation. But these are normal cells, and it requires pollution to transform the right cell at the right time in the right place into a cancer. And I think that begins to explain the rarity of the disease, but also the underlying risk that pollution holds for individuals in the world today. So although the risk of air pollution and lung cancer is much lower than tobacco, it's important to say that many more people are exposed to what the WHO would call unsafe levels of air pollution. It's estimated that over 95% of the population of this planet are exposed to levels of pollution that WHO would consider unsafe. So I think this is an urgent mandate to lower pollution levels. And of course, climate health and human health are intimately linked.